I mean, single-payer system is a lot of stuff that is now called premiums would have to be called taxes. It would enlarge the apparent size of the government without actually representing a real increase in the burden. So that's the main thing. It would actually, all the evidence is that single payer is cheaper than a private, far cheaper than a private insurance system, cheaper even probably than the kind of hybrid thing, which I hope we're going to get this year. I mean, I think it's been a bad week on healthcare, but we're probably still going to get healthcare, which hopefully will be, private insurance will still be there, but there'll be a public option competing with it. But a pure single payer would be cheaper. It has all the advantages. The only reason not to do it is that politically it's hard to do in one step. You have to convince people to give up the insurance. Forget about mollifying the insurance companies. That's not going to happen. But you have to convince people to completely give up the insurance they have. Whereas something that lets people keep the insurance they have, but then offers the option of a public plan, they evolve into single payer, but you can do it politically. And the point is a decision a lot of us have to make. If you think single payer is the right way to go, but you see the possibility of having a less good system, but still universal, with the possibility of improving, actually turn into legislation. I mean, we have a real chance that by the end of this year, universal health care will actually be law in America. Then you go for the imperfect system. But no, I was in Taiwan recently. Taiwan, just one big step. They just went to a complete single-payer healthcare system, Medicare for all in Taiwan, and it's worked beautifully. It costs less than projections. It's covered everybody. There's no problem with making it work. As some people say, healthcare, the economics of healthcare is easy. It's only the politics.